Hello and thank you for contacting Wave Support. From your request, it sounds like you have very nicely fitting lenses, but the patient is experiencing some discomfort, some achiness, and some pressure. Well, looking at your designs, I would have done exactly the same. These look great right out of the gates. And so the first thought I would have is to go back and make sure the patient doesn't have an underlying dry eye issue. But what I found in the past, quite often when they have that kind of pressury kind of discomfort, it usually suggests that they're getting lens edge awareness. Possibly these lenses are just a little too tight in the PC. Although they look great on the eye, I would go back and look and see, do you have a little bit of movement or a lot of movement? And what I would probably try to do is either one of two things or both, is to exaggerate that tear pump using either the 50% quadrant control as we do from our 8-point step, and just raise up that blue dot a few points, just try to exaggerate that tear exchange, or possibly just stay in the 100% and just increase that pink dot about 4 or 5 clicks. I probably personally would probably do a little bit of both, just to kind of cover all bets there, and just go a little bit more exaggerated to see how far you can push it. I think sometimes if you can get a little bit better tear exchange under those lenses, you'll have a little less rubbing and hopefully less discomfort as the day goes on. It sounds like your symptoms are probably a little bit more dryness due to tear exchange. Um, Next thought would be on the power. As you know, these are multifocal, large diameter lenses, and they tend not to move that much. And so if you're trying to encourage reading, I like your idea of going with a modified monovision. What I probably would do is maybe consider switching over to a near center lens, almost like a ProClear-like approach to these lenses. Maybe take the non-dominant eye and make it near center and leave the other one distant center. With those little changes, I think hopefully that'll get you a little bit more comfortable, or patient more comfortable. Again, go back and revisit, make sure there's not an underlying meibomian gland or dry eye issue that limiting the tear exchange, and then try to maximize the tear pumping, and that hopefully will give you a much more comfortable lens. I wish you well, and thank you for contacting Wave Support. Have a great day.